So we've talked about this a little bit, but really this is the idea here. 24-hour urine collections are the best way to figure out how you're doing with your treatment and to be making adjustments. So why are you asked to do them? You're being asked to do them because you need to make adjustments with your treatment. Unfortunately, a lot of patients have never known that or haven't had a doctor talk to them about what their 24-hour urine. I've seen too many times where you do the 24-hour urine, they go in, they say, hey, how are you? And then, everything look okay, but we got to just give you some more medication. You're like, okay. And then you walk out and you're like, well, I don't understand what the 24-hour urine was for. Nobody went over it with me. Be sure to ask your doctor what your numbers are. Find out what your numbers are. Know your numbers. Know what you need to do. And get yourself to try to get you below that 250 milligrams of cystine per liter of urine. And then in terms of imaging, yes, every doctor is a little bit different. I encourage you guys to now look. There was a paper just published. It's called the Consensus Guidelines to the Management of Cystinuria. You can Google it, and the paper will come up. And that paper really goes over step by step on how to treat cystinuria. And it's great to keep and have with you and even read it so that if you go to see your doctor and you're like, hey, these experts say that we should do this, this, and this. And then, these are like the biggest names in the world in kidney stone disease. And so I think any doctor would respect what these people say in this paper. And we're really excited. We didn't have anything to do with the paper, but we're really excited that the paper was written because now it's a guideline, step by step, how do you treat cystinuria in one of the best journals that urologists read. So nephrologists will pay very much attention to that as well. A couple of questions come in here. Yes.
Sorry to interrupt, but that paper is also available on the ICF's website, cystinuria.org. I believe you will be able to access it there on that website and download it. So not the Facebook page, but the website.
Yes, thank you, Sally. And the title, again, another patient has asked, is it's the Guidelines to Management of Cystinuria. Or, excuse me, Consensus Guidelines Management of Cystinuria. Okay, so question, is there a risk of false results if the 24-hour urine isn't refrigerated? Depends on where your lab is, what lab you're using. There are a good number of labs where you don't need to refrigerate the urine. There are some labs where you do. So you've got to be just making sure. Best advice I can give you with any 24-hour urine is read the directions to the 24-hour urine because they're often very complicated and that screws up results. So just read your directions and they will tell you everything you need to know. What's so critical about making sure you're following your treatment of any kind? The research is really clear. If you follow your treatment, you have less surgery. So let's put it this way. If you don't follow your treatment, you have a 1 in 2 chance of going back to the operating room in 3 months, according to the research. If you do follow your treatment of any kind, you have a 1 in 4 chance at 3 years. That's a huge difference. And it is possible that if you follow your treatment and you really stick with a treatment plan and you work with your doctor to get below that 250 milligrams of cystine per liter of urine, you very, very well have a 70% chance of remission with cystinuria, never forming another stone. It's possible, and it can be done, but you really have to be active in your treatment. And that's really what the goal of having this talk was tonight.